Okay, I greet you all. Hope you are doing fine. And I'm going to present or talk about laryngotracheobronchitis. It's one of the conditions that is found in pediatric and pediatrics nursing. So this is a critical condition that needs proper or immediate intervention in order to prevent the death of a child, because it is a critical condition that can affect the child, and also it can lead to the death of the child. So in this case, this condition is found in pediatrics, where we talk about children healthy. So in this case, we find that it is falling under respiratory system. So to take you through the anatomy of the respiratory system, you find that respiratory system is one of the systems that is very important in the human body, because that's where gaseous exchange takes place. So in the term laryngotracheobronchitis, as you can see, we have the larynx, which is part of the respiratory system, the trachea, which is also the part of the respiratory tract, which is also called the windpipe, and the bronchus, which is the bronchioles, the terminal bronchioles. We have bronchus and terminal bronchioles. So in this case, the respiratory system, to take you through the anatomy and physiology of the respiratory system, we find that it is made of the three processes that take place. Actually, there are four. So we have the pulmonary ventilation, that is where there is exchange of blood, exchange of gases between the blood and the airways in the air in the lungs, particularly in the alveolus. Then we have the external respiration. That's where there is exchange of gases between the atmospheric pressure as well as the blood in the lungs, particularly in the alveolus. Then again, we have internal respiration. This is the gaseous exchange that takes place between the cellular level or the tissues and the blood, where the oxygen has to move from the blood to the cells or to the tissues in order to maintain the metabolic processes. So henceforth, after understanding the background of respiratory system, you find that laryngotracheobronchitis, it is just an acute infective inflammation of the mucosa lining of the larynx, trachea, the bronchiole, caused by viral infections like influenza type 1 and type 2 virus, the measles virus, adenovirus. Also, we have herpes virus, but it can also be caused by a bacteria, like you talk of mycoplasma pneumonia and the streptococcal hemolytic beta group A. Those are the basic causes of laryngotracheobronchitis, characterized by the barking sound, which is called croup. So you find that the other name for laryngotracheobronchitis is croup. It is coming from that barking sound that is produced when someone is infected or has this type of a condition, or a child is affected with laryngotracheobronchitis. And also dyspnea, difficulties in breathing, may come in. Okay, so having defined laryngotracheobronchitis, you find that I've talked about the causes. It can be the viral, where we find influenza type 1, type 2, and adenovirus, measles virus. You talk of herpes virus, and bacterial cause, where we have mycoplasma pneumonia and the streptococcal hemolytic group A beta. So you find that the pathophysiology for this type of a condition that affects children goes like this. So you find that the primary cause of this condition is the viral infection, like I've talked about those viruses that cause this condition. So when there is that, you find that it will be due to infiltration of the white blood cells. They will be trying to fight that infection that is coming for a short period of time. So you find that when there is that infiltration of white blood cells, it causes the narrowing of the airway or the air passage, or constriction of the bronchioles. So you find that the inflammation of the mucosa lining of the upper respiratory tract, specifically the larynx, the trachea, and the bronchioles, you find that when there is that inflammation, you find that it will lead to pulmonary edema. And when there is that pulmonary edema, it also leads to obstruction of the tube, causing difficulties in breathing because the airway is obstructed. So as the obstruction continues or increases, you find that different signs and symptoms will manifest in this case. You find that there will be continuous stridor, and that sharp sound that will be produced. There will be nasopharynx due to hypoventilation. There will be also fever, great fever that will come in as a result of inflammation and also the presence of infection. So you find that there will be suprasternal and intercostal retractions due to the baby or the child having difficulties in breathing due to the obstruction of the airway as well as the pulmonary edema, and that is there. You find that there will be dyspnea, hoarseness of the voice. The voice will be affected because we have the larynx. In this case, you talk of laryngotracheobronchitis. The larynx is disturbed. You find that there will be hoarseness of the voice. Even the barking sound now will come in due to the obstruction as well as the pulmonary edema. That's where the other name for laryngotracheobronchitis comes in, as that barking sound that is produced, which is called croup. So we have also coughing will be there due to that edema because there will be formation of tenacious fluid or cough, and that will be resistant from coming out. You find that the baby or a child will try to cough out to release, and that thing that is blocking the airway, but it will not come out because it is thick. So those are things that you have to talk about under laryngotracheobronchitis. Thank you so much for your attention. May God bless you.